Welcome to the NCLEX Practice Test for Psychosocial Integrity. This practice test consists of 40 questions that cover a variety of topics related to psychosocial integrity, including communication, coping mechanisms, mental health, cultural diversity, and more. Each question comes with a correct answer and detailed explanation to help you better understand the materials. If you found this video helpful, be sure to like the video and subscribe to our channel for more resources. Let's get started. 1. In which of the following ways can the nurse promote the sense of taste for an older adult? A. Mix foods together on the dinner tray. B. Avoid cologne, air fresheners, or room deodorizers. C. Encourage the client to chew food thoroughly. D. Discourage the use of salt or seasonings with prepared food. Correct answer: C. Encourage the client to chew food thoroughly. As clients age, their sense of taste may diminish, reducing the joy that comes with eating. A nurse can promote the sense of taste for a client by encouraging him to chew his food thoroughly while eating. This results in longer contact of food with the taste buds and a greater chance of tasting the food. 2. A nurse is caring for a client who died approximately 1 hour ago. The nurse notes that the client's temperature has decreased in the last hour since his death. Which of the following processes explains this phenomenon? A. Rigor mortis. B. Post-mortem decomposition. C. Algor mortis. D. Livor mortis. Correct answer: C. Algor mortis. Algor mortis occurs after death when the body's circulation stops and the client's temperature begins to fall. The client's temperature will drop by approximately 1.8 degrees per hour until it reaches room temperature. The client's skin gradually loses its elasticity during this time. 3. A nurse is caring for Mrs. T, a client with expressive aphasia. During a bath, she begins to gesture wildly and point toward the bath water, yet is unable to say anything. Which response from the nurse is most appropriate? A. Is something wrong with the bath water? B. Just calm down, we'll finish your bath soon. C. Are you trying to tell me something? D. Shall I turn on the television? Correct answer: A. Is something wrong with the bath water? A client with expressive aphasia can understand when others speak to her, but may be unable to form the correct words or phrases to respond. In this situation, the client is obviously trying to tell the nurse something, but cannot get the words out. The nurse should try to pinpoint the subject the client is trying to bring up. 4. A patient with leukemia is being taken off life support and the patient's daughter says to the nurse, "This should be my mom dying, not my dad. She has drank all these years and is still living." Which stage of grief is the daughter in according to Kubler-Ross? A. Denial. B. Anger. C. Bargaining. D. Depression. Correct answer: B. Anger. The daughter is experiencing anger, the second stage of grief according to Kubler-Ross. During this stage, a client displaces anger at the situation onto other people or things. 5. Which of the following interventions is most appropriate for a client with a diagnosis of risk for activity intolerance? A. Perform nursing activities throughout the entire shift. B. Assess for signs of increased muscle tone. C. Minimize environmental noise. D. Teach clients to perform the Valsalva maneuver. Correct answer: C. Minimize environmental noise. When caring for a client who is at risk of activity intolerance, the nurse can diminish the impact of environmental stimuli by reducing noise. Environmental noise may require further energy from the client in order to manage his responses to stimuli. Reducing excess noise promotes rest and energy conservation. 6. A nurse is working with Mr. L, a client who is being seen for disrupted sleep patterns. The nurse encourages Mr. L to verbalize his feelings about sleep and his inability to maintain adequate sleep habits. What is the rationale for this action? A. Mr. L most likely has a mental illness that should be treated before his sleep issues. B. Mr. L may have unrecognized anxiety or fear that could be contributing to poor sleep habits. C. Mr. L may become tired once he starts talking. D. None of the above. Correct answer: B. Mr. L may have unrecognized anxiety or fear that could be contributing to poor sleep habits. Some clients have difficulties with sleep due to unrecognized anxiety or fears. By encouraging clients to express their feelings and thoughts regarding sleep and sleep issues, the nurse allows the client the chance to work through negative feelings. By working out potential issues, the client may experience greater peace and relaxation, promoting sleep. 7. Which of the following is an example of physical abuse? A. A slap to the person's hand. B. Threatening the person. C. Ignoring and isolating a person. D. Leaving a patient soiled for hours. Correct answer: A. A slap to the person's hand. Slapping, hitting, and punching are examples of physical abuse. Physical abuse is defined as doing something that can physically harm or injure a person. 8. Which of the following is an example of emotional abuse? A. A slap to the person's hand. B. Threatening the person. C. Ignoring and isolating a person. D. Leaving a patient soiled for hours. Correct answer: B. Threatening the person. Threatening a patient is an example of emotional abuse. 9. Which of the following is an example of emotional neglect? A. A slap to the person's hand. B. Threatening the person. C. Ignoring and isolating a person. D. Leaving a patient soiled for hours. Correct answer: C. Ignoring and isolating a person. Ignoring and isolating patients are examples of emotional neglect. Emotional neglect is not doing the right things in order to meet the emotional needs of patients. 10. A patient has a goal of eating at least 50% of each meal. The patient refuses to eat, so a nurse force feeds the patient in order for them to reach their goal of eating at least 50% of the meal. The nurse has committed against this patient. A. Assault. B. Battery. C. Physical neglect. D. Emotional neglect. Correct answer: B. Battery. Battery happens when a person is actually touched without their permission. It is a battery if a nursing assistant slaps or pushes a patient. This is also physical abuse. 11. A term used to describe members of the same group based on physiological characteristics, such as skin color or body structure, is known as A. Ethnicity. B. Culture. C. Race. D. Minority. Correct answer: C. Race. Race is a term used to describe people who are members of the same group that is based on physiological characteristics, such as skin color. Race may be paired with ethnicity, in that members of the same race may be of the same ethnic background. 12. Which of the following scenarios provides an example of a nurse overcoming a barrier to communication? A. A nurse uses lecture as a means of explaining how to run a finger-stick glucose test to an elderly patient. B. A nurse writes her directions to a patient that is hearing impaired. C. A nurse speaks loudly to a patient who speaks a non-English language. D. A nurse uses the terms micturate and defecation while talking with a minor. Correct answer: B. A nurse writes her directions to a patient that is hearing impaired. Overcoming barriers of communication involve using methods of communication that are understandable to the receiver. In the example provided, a deaf or hearing impaired patient would have an easier time understanding directions if they are written to overcome the obstacle of hearing loss. 13. A patient who is displaying the defense mechanism of compensation would A. Refuse to hear unwanted information. B. Transfer feelings of negativity to someone else. C. Overemphasize behaviors which accommodate for perceived weaknesses. D. Place blame on others for personal actions or mistakes. Correct answer: C. Overemphasize behaviors which accommodate for perceived weaknesses. Compensation means to overcome a perceived weakness by overcompensating another behavior or personality trait. 14. Assuming that an elderly patient will have a difficult time understanding the directions for how to take medication is an example of A. Prejudice. B. Stereotyping. C. Encoding. D. Rationalization. Correct answer, B. Stereotyping. Stereotyping is defined as providing a generalization about a person based on his culture. The nurse in this situation was stereotyping her patient by believing that her patient would automatically have a difficult time understanding directions based solely on the fact that the patient is elderly. A prejudice is forming a negative opinion of someone based on his or her heritage or culture. 15. The nurse overhears the mother of a baby who was admitted to the NICU for necrotizing enterocolitis state, "God, if you let my baby live, I promise I will go to church every Sunday, pray every day and involve my family back into my life." Which stage of grief is the mother in according to Kubler-Ross? A. Denial. B. Anger. C. Bargaining. D. Depression. Correct answer, C. Bargaining. The mother has entered the bargaining stage of the 5 stages of grief according to Kubler-Ross. During this stage, the mother bargains with God for her baby to live. Often clients who are in this stage negotiate or bargain for a cure or more time. 16. Which of the following questions is considered open-ended? A. What time did you last take your medications? B. Are you feeling okay right now? C. Please describe your symptoms. D. What day are you available for a follow-up appointment? Correct answer, C. Please describe your symptoms. Open-ended questions are questions that will yield an answer that is detailed and descriptive. Closed-ended questions will yield answers that are 1 or 2 words in length. 17. A patient displays the following body language: slumped shoulders, grimace, and stiff joints. What message is this patient sending? A. Anger. B. Aloofness. C. Empathy. D. Depression. Correct answer, A. Anger. Body language is a form of nonverbal communication. Negative messages can be sent easily with the use of improper or tense posture. Anger is conveyed by grimacing as if in pain and tensing the shoulders. 18. A patient who refuses to believe a terminal diagnosis is exhibiting A. Regression. B. Mourning. C. Denial. D. Rationalization. Correct answer, C. Denial. Denial is a defense mechanism that allows a patient the ability to avoid negative emotions that result from an unacceptable reality. 19. Which of the following may be a cultural barrier that impacts a nurse's ability to provide care or education to the client? A. A nurse offers educational materials to a client that are written at an 8th grade reading level. B. A Vietnamese woman wants to use steaming in addition to her prescription antibiotics. C. A nurse uses pantomime to explain a procedure to a deaf client. D. A Native American client requests a healing ritual before he will consider surgery. Correct answer, C. A nurse uses pantomime to explain a procedure to a deaf client. Cultural barriers can impede communication, preventing the nurse from providing education or instruction about a client's care. Cultural barriers may be subtle or obvious. However, the nurse may not always know the various practices and beliefs performed by other cultures. Pantomiming instructions to a deaf person implies that the nurse does not recognize the importance of a sign language interpreter. This barrier is likely to cause miscommunication if the client does not understand the nurse's gestures and actions. 20. Which of the following is an example of low health literacy skills? A. A nurse's aide cannot calculate the correct rate for Ringer's lactate. B. A client cannot read an admission form to sign it. C. The nurse is unable to explain the dose, indications, side effects, and structural formula of carbamazepine. D. A client does not understand the treatment for his cholecystectomy. Correct answer, D. A client does not understand the treatment for his cholecystectomy. Some clients or families have low health literacy skills, rendering them unable to understand the reasons for health treatments or diagnoses or to make informed decisions about healthcare. Low health literacy differs from literacy skills in that reading and writing abilities are not necessarily reflective of understanding medical terminology. 21. A nurse is caring for an inpatient client in the hospital who is from another country and who fasts for temporary periods in order to promote his own spiritual growth. The nurse responds by saying, "You need to eat something while you are here. Food and proper nutrition is extremely important for your health." What social philosophy is the nurse demonstrating? A. Ethnocentrism. B. Relativism. C. Stereotyping. D. Xenocentrism. Correct answer, A. Ethnocentrism. Ethnocentrism is a concept that believes a person's own cultural practices are superior to all others. Ethnocentrism does not accept other practices as being valid, but instead insists that certain beliefs are better or correct for all people. In this case, the nurse was unable to see past her own set of beliefs about healthcare to understand why the client did not want to eat. 22. A nurse is using active listening as a form of therapeutic communication when A. She uses humor to put the client at ease in a situation. B. She restates what the client said in slightly different words. C. She uses eye contact and maintains an open stance while the client is talking. D. She provides personal information to show the client she can relate to him. Correct answer, C. She uses eye contact and maintains an open stance while the client is talking. Active listening is a form of therapeutic communication in which the nurse encourages a client to speak or share his thoughts. Some clients may be uncomfortable discussing their care, their thoughts, or feelings with nurses. However, nurses can encourage this dialogue by maintaining eye contact and keeping an open stance that indicates listening, rather than trying to work and talk at the same time. 23. A client asks a nurse, "Do you think I should move back home after this procedure?" And the nurse responds by saying, "Do you think you should move back home?" What type of therapeutic communication is the nurse representing? A. Observation. B. Reflection. C. Summarizing. D. Validating. Correct answer, B. Reflection. When using reflection after a client asks a question, the nurse turns the conversation around so that the client considers his own answers to the question. Reflection often involves restating a statement or question so that it is directed from the nurse to the client, rather than the other way around. This requires the client to reconsider his own question or thoughts about a situation. 24. A nurse walks into a client's room to find the nursing assistant yelling, "Sit back down or I won't help you eat and then you will starve." This type of behavior is known as A. Psychological abuse. B. Abandonment. C. Material exploitation. D. Physical abuse. Correct answer, A. Psychological abuse. This behavior is classified as psychological abuse. This type of abuse harms another person through words or threats. The person instilling the abuse may yell, harass, call names, threaten, or humiliate another person. In this situation, the nursing assistant was exercising control over the client by using psychological abuse to threaten him. 25. A nurse is talking to the daughter of a patient who just passed away following complications of a motor vehicle accident. The toxicology results reveal the patient's blood alcohol content was 2.0. The daughter states, "My dad has missed every softball game of my daughters this year and now he is gone. I cannot believe he would be so stupid as to drink and drive." Which of the following statements by the nurse would facilitate mourning? A. The silver lining is that your dad didn't kill anybody else. B. It will be okay. It seems as if you have a strong support system to get through this. C. Is your daughter going to be okay? D. I can sense you're angry. That is a normal response to this situation. Do you want to tell me more about how you are feeling? Correct answer, D. I can sense you're angry. That is a normal response to this situation. Do you want to tell me more about how you are feeling? This statement by the nurse is an example of therapeutic communication. The response names the feeling the client is exhibiting and opens up the lines of communication with an open-ended question. In this situation, the nurse wants to avoid any responses that take away from the grieving family member, offers false reassurance, changes the subject, or is advice. 26. A nurse is examining a woman who has bruises on her face and back in various stages of healing. The client states, sometimes he just gets so angry. Which of the following statements is most appropriate as a response from the nurse? A. Do you mean your boyfriend? B. You need to leave him as soon as possible. C. No one will ever hurt you again. D. Tell me more about what happens when he gets angry. Correct answer, D. Tell me more about what happens when he gets angry. The nurse assessing this client should try to derive more information from her before making a judgment or decision. Additionally, the nurse should find out more details of the situation, such as whom the client is talking about or what happens when he gets angry, and she should not give advice or make false promises. 27. A nurse is caring for a dying client whose family wants to be with him in the operating suite. The surgeon, however, does not allow families to be present during surgery. The nurse recognizes this as an ethical dilemma. What is the initial step of the nurse when managing this situation? A. Contact the physician to amend the order for the client. B. Document an account of the situation to ensure adequate coverage of details. C. Consult with the medical ethics committee to determine a safe and workable solution. D. Speak with the chief nursing officer to change the policy governing this situation. Correct answer, A. Contact the physician to amend the order for the client. In this type of situation, the first action of the nurse should be to ask the physician to make a change based on the circumstances. While documentation and consulting with higher authorities may be necessary eventually, the first step is to try to meet the needs of the client with the potentially short time allotted. 28. A nurse is assigned to care for a deaf client. During her lunch hour, she visits the hospital library and reads more about deaf culture in order to better provide appropriate care for her client. This action is an example of A. Cultural knowledge. B. Cultural noise. C. Cultural diversity. D. Cultural divide. Correct answer, A. Cultural knowledge. Cultural knowledge involves looking for information and educating oneself about different cultural groups. The nurse who cares for a client with a language that differs from her own and who strives to learn more about the deaf culture is exhibiting cultural knowledge. Practicing cultural knowledge works to reduce cultural barriers that can impede communication between nurses and clients. 29. Which of the following clients have a barrier to accessing healthcare? A. A 36-year-old client who must use a wheelchair for mobility. B. A 44-year-old client who is visiting the United States on a visa from India. C. An 81-year-old client who is unable to drive. D. All of the above. Correct answer, D. All of the above. Barriers to accessing healthcare may take many forms, whether it is physical, financial, or cultural. Clients who have physical limitations may face barriers with movement or travel. Those with language barriers may have difficulties with communication if an interpreter is not present or available, and clients who are unable to access their services, such as those who are homebound, face barriers to receiving healthcare. 30. A client in a long-term care facility tells the nurse, "My daughter never visits me." The nurse responds by telling the client that when her own mother was in a long-term care facility, she found it difficult to visit. This is an example of which communication technique? A. Empathy. B. Self-disclosure. C. Disapproval. D. False reassurance. Correct answer, B. Self-disclosure. Self-disclosure is a type of therapeutic communication technique that nurses may use with clients to encourage them to share more information. Self-disclosure may help a client to feel more comfortable with sharing, believing that the nurse personally understands. Self-disclosure may also be a negative technique if the nurse shares too much information or the client becomes uncomfortable. 31. A nurse caring for a pediatric client shows little concern when the parents attempt to speak with her about their daughter's illness. When approached by the nurse manager about her behavior, the nurse responds by saying, "I don't want to get involved. It doesn't matter what I do anyway, my work does not make much of a difference." This nurse is exhibiting which of the following characteristics? A. Objectivity. B. Depersonalization. C. Procrastination. D. Disruption. Correct answer, B. Depersonalization. A nurse who sets herself apart from her clients to avoid becoming involved is using depersonalization. This behavior may occur among nurses suffering from burnout as a result of stress. Depersonalization is often the result of poor morale or feelings of moral distress and may act as a defense mechanism to avoid feeling greater burdens when under stress or emotional exhaustion. 32. A nurse is asked by a physician to speak to a colleague about her unprofessional behavior in front of a client. The nurse does not want to create conflict with her colleague, so she does not confront her and stays away from the physician when he comes in to work the next day. Which type of conflict resolution is this nurse exhibiting? A. Accommodation. B. Competition. C. Avoidance. D. Negotiation. Correct answer, C. Avoidance. Avoidance is a form of conflict resolution that seeks to ignore the problem in hopes that it might go away on its own. Avoidance is a passive form of resolution in that it usually does not accomplish the intended action. While keeping distance may allow others involved to obtain more insight about the situation, avoidance often does not result in resolution of issues or problems. 33. You have accompanied the physician into the family waiting room to tell a young husband that his wife has not survived the car accident she was in. The husband is crying and distraught. What is the most appropriate approach to supporting this family member? A. Ask if he would like to donate his wife's organs. B. Sit quietly with him. C. Ask about funeral arrangements. D. Consult social services. Correct answer, B. Sit quietly with him. The most caring and supportive approach in a time of extreme distress is usually to sit quietly with the distressed party, until he's had the opportunity to absorb the news and gather himself. Providing a supportive presence is often the most valuable tool a nurse can use when circumstances provide overwhelming emotional pain to those they are caring for. 34. Rachel is a 48-year-old mother of 3 who has been admitted after a drug overdose in a failed suicide attempt. When she regains consciousness, she states that she is ashamed and embarrassed that she tried to take her own life. What is the most therapeutic response to Rachel's statement? A. It's a blessing your children weren't left without a mother. B. What were you thinking? C. We're here to help patients who value life. D. I know life can be difficult. We're here to help you. Correct answer, D. I know life can be difficult. We're here to help you. Offering non-judgmental support and hope is the most therapeutic response which will help the patient to maintain her self-esteem. The nurse's role is to treat all patients with respect and dignity, regardless of the situation, and offer supportive measures which will benefit healing in all realms. 35. A male nurse that is working on a labor and delivery unit has been pulled from providing care for a patient who is of the Islamic faith. The patient asks the charge nurse to remove her from the nurse's assignment. The charge nurse understands, fulfills her request, and notifies the nurse. Which explanation by the charge nurse is correct? A. We must honor any wishes made by the patient. B. A male nurse should not be in the delivery room when a woman is giving birth. C. Islamic women must only receive care by female healthcare providers during birth. D. Only doctors and midwives are permitted in the delivery unit. Correct answer, C. Islamic women must only receive care by female healthcare providers during birth. Islamic women must be cared for by female healthcare providers during childbirth. There are also strict guidelines in their religion that require them to cover their head/body when a non-immediate family member is present in the room. 36. A 42-year-old female was admitted to the ICU following complications after a motor vehicle accident. The patient suffered a traumatic brain injury, TBI, and is now intubated and non-responsive. The patient's daughter is 17 years old and is at the bedside alone. She is sobbing, saying, "She is all I have. If she dies, I want to die too." What question by the nurse elicits the most information in evaluating the daughter's support system? A. Do you need to talk to a social worker? B. Do any family members live close to you? C. How old are you? D. What school do you go to? Correct answer: B. Do any family members live close to you? It is important to determine the daughter's support system in this scenario by asking what other family members live close that could help her or that she could temporarily live with during this time. It becomes the nurse's responsibility to gather information. It then would be appropriate to consult a social worker. 37. Family members of a patient ask repeated questions about the monitors and various readings in the patient's room. What is the most supportive response to their questions? A. Inform them that you cannot take the time to answer all their questions. B. Provide detailed explanations for each device. C. Tell them it's too technical to explain. D. Provide an overview and encourage them to spend their time with the patient. Correct answer: D. Provide an overview and encourage them to spend their time with the patient. Addressing the family's questions and providing an overview of information validates their concerns and addresses their requests. Limiting details and encouraging them to focus on the patient helps to avoid anxiety, which could be created by focusing on values that should be interpreted in the context of the patient's situation by professionals with experience with such data. It also encourages them to provide what they uniquely have to offer, a comforting presence for their loved one. 38. The mother of a 3-year-old pediatric patient would like to remain at the patient's bedside throughout the night. The patient seems to be calmer when she is present. What is the most caring and appropriate response? A. Reinforce visiting hours. B. Allow her to stay for a short period beyond normal hours. C. Allow her to stay throughout the night. D. Offer to get bedding for a couch in the waiting room. Correct answer: C. Allow her to stay throughout the night. Allowing the mother to stay throughout the night is the most caring and appropriate response. Most pediatric facilities recognize the vital role the parent plays in the patient's care, and are supportive of unlimited visitation. Providing supportive understanding of the needs of both the patient and mother will enhance rapport and cooperation. 39. You are caring for a Hispanic patient who is scheduled for surgery in the morning. A member of the surgery staff is in a hurry when she visits the patient to obtain surgical consent. You know that the patient speaks limited English, and can see that he does not really understand what's being said. What is the most appropriate next action? A. Call a family member to interpret. B. Consult the hospital translator to assist. C. Allow the consent to be signed. D. Ask the staff member to come back later. Correct answer: B. Consult the hospital translator to assist. Consulting the hospital translator is the most reliable means of ensuring accuracy in the information that the patient is receiving. Family members can be helpful, but may have difficulty understanding the medical procedures well enough to explain them, and may skew the message being delivered, depending on their view of the situation. Translator collaboration is vitally important to ensure that language barriers do not adversely affect patient care. 40. Brandon is a 38-year-old with a history of cocaine addiction who has just been admitted for his second myocardial infarction that was due to cocaine use. What collaborative process should begin as soon as Brandon is stable enough to interact with additional resources? A. Law enforcement for further prevention. B. Social services for rehab. C. Narcotics Anonymous. D. financial counselor to apply for assistance. Correct answer, B. Social services for rehab. After stabilization, Brandon should be connected with additional resources to help him deal with his addiction. Social services is an excellent collaborative partner, as these professionals have access to available resources in the community that would be helpful for Brandon's issues. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channels for more resources.